N. Deepa completed PG Diploma in Yoga, studying International Yoga Therapy course from Manushi Institute of Yoga affiliated with IIT. Practicing and teaching yoga more than 6 years.
M. Deepa, Health Warriors of Yoga Therapy. We are proud of your yogic services.
Introduce about PCOS. PCOS is a condition wherein the ovaries have multiple small cysts, hence it is called as polycystic ovarian syndrome. The cysts are not determined.
Excuse me, kindly play the screen.
I'm playing. I'm able to see my screen, ma'am. You're not able to see my screen.
Yeah,
It is visible, ma'am.
See, madam, but you put F5, no, that one by one the screen will come. All screens are seen now. That's right.
Ma'am.
Okay, no problem. You please proceed.
Okay. The cysts are not determined but lead to hormonal imbalances. Unhealthy lifestyle, wrong food habits, and lack of exercise are some common contributes factors towards the illness. Going ahead with that, irregular or missed periods, weight gain, fatigue, unwanted hair growth may be seen on the face, arms, chest, back, and abdomen. Hormonal changes associated with acne, hair thinning on the head or sudden hair loss, mood swings, depression, and anxiety. Pelvic pain may occur during PMS periods along with the heavy bleeding or spotting and sleep disorder. So scientific studies for PCOS, which is polycystic ovarian syndrome, is the most common in female endocrine disorder with prevalence estimates ranging from 2.2% as high as 26%. It is believed that both genetic predisposition and lifestyle factors contribute to the etiology of PCOS. Altered lifestyle that includes high calorie diet and lack of exercise resulting in obesity and insulin resistance, which has been well recognized as an exacerbating factor for PCOS. Association between stress and PCOS has also been documented. Adult women with PCOS have a tenfold increased risk of developing type 2 diabetes and a twofold increased risk of metabolic syndrome. There are studies suggesting that chronic stimulation of sympathetic activity, a result of stressful lifestyle, can induce dysregulation of hypothalamus, pituitary, ovarian axis in women with PCOS. The aim of yoga therapy for PCOS first is like to reverse the PCOS, which is polycystic ovarian syndrome, to correct the lifestyle through natural way, through the physical activity, through the proper healthy diet, which is sattvic food, we can say, to help them to balance the hormonal changes, to lead the healthy lifestyle, to reduce the infertility, to reduce the obesity. The reasons, as all we know, sedentary lifestyle, which is like without physical activity, sitting in one place, especially now it is common. It is not like we cannot consider that as a mistake. Due to the work lifestyle, we can say that, see, people after COVID, like most of them, we are working from home. So like you have to sit in front of the computers, like you can say 8 hours, 12 hours, sometimes it can exceed also. Wherein you don't focus on your physical body, or you will be focusing on the screen, what you're doing. We do not focus on the posture, how we sit. Are we eating the healthy diet? Are we eating on time? Are we relaxing ourselves? We don't focus on ourselves at all when we focus on our, especially when it comes to the profession. And which is common in the college studies students, we can say, especially the girls and even the boys also. The PCO is common in females, so let us relate it with the college studies girls. they don't, I mean, like as we talk about the professions, we can go ahead with the students. They'll be keep studying on, like on their so and so fields. They'll be not focusing on what they are eating. They'll be we can consider as malnutrition. It is not that they don't, they have food to consume. They are not eating the, healthy diet. We can say they are more on junk food, and not eating on time, no proper sleep. All these considered as sedentary lifestyle. As well as when it comes to the stress, as we discussed before, it can be a family stress or work stress or social behavior and stress, etc., etc. Unhealthy diet, which I have already discussed with you. Exposing more to the junk food and not eating not exposing to the vegetarian, fast food, we can say. And you prepare 2 minutes of noodles and consume, and you think that okay, I'm done with my food. It can be breakfast or lunch or dinner, like that. So evaluation procedure, there is no actual evaluation for the PCOS. When you have oligomenorrhea, which is like infrequent periods, which is like more than 30, 45 days, that time you may have a periods, or amenorrhea, which is absence of your periods. And clinical or biochemical hypoandrogenism. And finally, they will be, they will do the ultrasound. Through that, they will find out the condition of the PCOS. So structuring the therapy, see, when we come to the PCOS, there is no particular, there is no much restrictions for PCOS condition. Here we have to focus from head to toe. But here we will be focusing more on the lower body, the pelvic area, the thighs, the abdomen, the internal organs which are related like uterus, etc. So we are going to focus more on the lower body, wherein you are going to stay for longer period in that particular posture which is related to your PCOS, which I told you, like thighs, uterus, abdomen, etc. In that, I've given only specific very few asanas, Setu Bandhasana. So in the posture, in the pic, you can see that when you in Setu Bandhasana, you're going to lift your pelvic floor here. So you're going to stretch your pelvic muscle, which is related to the thighs, the abdomen, and you can see the back also is stretching in this. Next comes to Bhujangasana. As well as same Bhujangasana, we are focusing more on the lower body. Your spine and your lower body is stretching in Bhujangasana. And the third one, again, same thing. Here we are focusing more on the abdomen region. And Baddha Konasana. Baddha Konasana, wherein you join your feet, and when you stretch your muscles, you get very good stretch in your thighs as well as in your uterus. Then the Balasana, which you are going to relax yourself, which you are going to calm your mind. So the method, we can say that, okay, there are we have to follow this steps, we can say, instead of the method. First is as we all know, we have to practice in the empty stomach. The advisable time is early morning, because the whole night our stomach will be empty. So the right time is morning. If we are busy, if a person is so busy with the office or studies, etc., they can practice in the evening as well, after 4 o'clock or after 5 o'clock. But we should have a gap of 3 to 4 hours of, after the lunch. After the lunch and between the break, between our practice, we should have minimum ideal gap of 3 to 4 hours. And we can start our, we have to start our practice with the relaxation of the mind. Is when we have when we say Om chanting, when we have restrictions, people who do not chant Om, we can suggest them Nada Anusandana. We can ask them to chant Akara, Ukara as well as Makara. Like that, we have to start our practice with the prayer. And we have to find out with the client, when the person came that with the PCOS condition, we have to ask them, we have to educate it is superficial education for the person who come for practice. We have to ask them like according to their timings and are they okay with the group session. We have to explain them what is that. I mean, see, so and so group session and personal session will happen again based on the client's requirement. We have to give the group or personal session to the client. Again, I said why I said superficial education, because I will tell, see, you do this asana with consciousness, you will get the benefit, you will be able to reverse the PCOS. But all these will be superficial knowledge to the client, because they don't know, they haven't gone through that stretching till today. So I can say whatever I can say, it will be like only superficial knowledge to them. But once they start practice, once they stretch the muscle, then it will be a actual knowledge for them. It is like in-depth knowledge to them, because they are experiencing. Like I can say, but the practical knowledge is different and the theory knowledge is different. With the theory knowledge, you apply the practical knowledge, then you will get to know the posture benefit and the benefit of yoga. So here we will have different personalities. A person who is thin, it may not, it is not that okay, you are thin and you are flexible. No, a person who is healthy, are they flexible? No, don't know. So it depends on the flexibility. So according to the flexibility, we can go through the, we can give the practice with the props or without the props. For example, when we do 30-90 leg raising asana, some people they will do with ease, but some they may not be able to. So that time we can advise them to use the belt and bricks for balasana, for example. A person who is little healthy, so he is not able, she's not able to bend forward because the stomach will stop them. So we can give the bolster, or we can ask them to use the bricks to rest the head down. Like that, we can use the props, and we can suggest the asanas. So as we start, we have to always add 5 points in the practice. First, like relaxation with the prayer. Then second one is like loosening the body. Without loosening the body, there may be chances of muscle pull, breaking the bones, etc. So the warm up is compulsory in our practice. Then we have to advise the asanas. Then immediately after the asana, pranayama to calm the mind, to reduce the stress, pranayama, which is compulsory and must and should. After the pranayama, and during the pranayama, we can advise related mudras to the so and so condition. And after that, we have to relax our body. After the stretching of the muscle, relaxation is must and should. And if they have time, or else we can advise them to do the meditation in the class, or whenever they are free. So the themes, commitment is very much important. When a client comes, or else I can consider myself as a client. When I will be in a condition wherein that I do not want to go for pills. Without pills, I want to heal my disease. So I will be very very excited to start my practice, etc. When I hear, okay, I will get up at this time, I will start my practice. But how many days will it happen? Whether am I having that same excitement only for a week, or else only for 2 days? No. Minimum 3 months to 6 months of practice will definitely give you the results. As sir before he said, like within 3 days, 4 days, no, minimum of 3 months, you will see the changes, but you have to give 3 months of 90 days period to see the changes. After that, you can see complete changes, wherein you can reverse without the pills or without the medication. And duration. So if a person who is so busy, who don't have time at all to spend 1 hour, at least 30 to 45 minutes of practice, which is very much compulsory, wherein we are going to add 5 points in that. Observe the progress. As we discussed just before, you will not be able to see the changes within 3 to 5 days minimum. After a month or within 2 weeks itself, you will be able to see the changes in your mind state as well as in your physical state. But you have to wait for 3 months of time, then you will see the changes. As I told you, 90 days of practice is compulsory to get the results. The summary. PCOS is just an autoimmune disorder because of wrong lifestyle. We can reverse the PCOS condition with the lifestyle modification, such as physical activity. We are yoga therapists, so I will be talking about yoga. The healthy diet, like consumption of sattvic food, more on vegetarian food, more on healthy food, which has more on pranic energy, and leading to eco-friendly lifestyle. We don't expose much to the environment, especially after work from home. You'll be sitting at home, and I mean, you don't see exposed to the sunrise nor even the sunset. So try to be friendly to the environment. Happy hormones will secrete when we stretch the muscle. Just feel as soon as we stretch the hands. See, body is stretching, the muscles are stretching. When we stretch the muscles, the happy hormones are secreted, like serotonin, dopamine, endorphin, etc. So let us stretch the muscles and burst the stress, and let us live a happy, healthy lifestyle. Thank you, ma'am.